Hey, Charles Maverick Carmel. Good evening, guys. I hope everyone had a good Memorial Day weekend. It was started off a little slow, but we really ended up having a very good time. We ended up sort of celebrating a birthday party of Dr. Moray, who most of you know. Hey, Jen. And we ended up having people over to our house, kind of for a pool party. One day was more of a kid's day. Hey, Tracy. And one day was more of sort of a grown-ups day with grown-up beverages and those sorts of things. But it was a lot of fun, and I hope you all enjoyed it. The weather was really quite good compared to what we've been having. In fact, some insensitive people even said it was too hot, and we all booed and hissed them down because you don't say that, even if you think it, because it's been so long since we really had some nice weather, and today is another beautiful day. So I hope you all had a chance to do that and think about the people that did give their lives for our country and for our freedoms and allowing us to live the lives we do live. And I'm sure we're all grateful to them. And a day of remembrance is important because it's always important to remember where you came from and how you got there and who helped you, right? And who mentored you and who made it easier for you to be successful. So hopefully we're doing some of that for you, and hopefully we're helping you in some way in your career. It was funny because, when you have these holidays, and we ended up getting Friday off, so it was sort of a 4-day holiday. And I'm driving home tonight, and I'm thinking, oh, you know what? I'm going to surprise my wife, and we'll just go for a drink by the pool. We'll just relax. And I'm like driving, and I'm looking at the clock, and I go, wait a minute, isn't today Tuesday? And I'm supposed to be doing my live? And then I started to drive a little faster and get home, and I'm like, I guess we'll have to either do it later or do it another time. But you know how, like, today it's always Monday to me because it's the first day back, but it was really a Tuesday Monday, which made it very confusing for me. And I had to do something at the end of the day, so I was out of the office, and I was just all over the place. But anyway, I'm happy we're all here together tonight and talking about mentoring. And tonight, I've been asked to talk about some of the most common problems I see, when people come in with complications, problems, issues, questions, concerns, bad results, whatever, and maybe how we can fix them. Hey, Brittany, long time no see. Hello, Saitan. You guys haven't been here for a while. It's good to see you guys back on track. So what are some of the most common problems we see? Because, the thing is, it's sort of predictable. I do tend to see them over and over and over again, and it's obvious to me that the level of aesthetic education that most providers have is pretty low, because everyone makes mistakes. That's not the issue. The issue is if you make a mistake, you try to learn from that mistake so you don't do it again. And if you keep repeating the same mistake over and over again, you really aren't learning anything. You really aren't doing anything positive, and you're actually creating problems for your patients. So mistakes are okay, but not learning from them is not okay. So always, strive to be your best. And when you have an outcome that isn't perfect, really think about why. And, it really only breaks down to a couple of things. And most of the time it's anatomy, it's misunderstanding dosing, it's misunderstanding how to place product and how to do the injection safely and effectively. But so if you ask me, what are one of the most common things I see that I kind of tend to see over and over again, and it may surprise you. Does anyone have a guess as to, like, what you think is the most common area of the face? Let's talk about, we'll kind of narrow it down a little bit, where I see results that aren't very good. And it indicates to me that there's a misunderstanding of the anatomy in those areas. Does anyone want to just say, what area do you think I see most complications related to facial injections? I'll even narrow it down for you. Upper third, middle third, or lower third? Brittany, you want to take a guess? Or Brittany probably knows. Carmel, you want to take a guess? Anybody out there? Jamie? Cindy? Hello, guys. I'm going to start waving back. So I'm just asking people, where do you think I see the most number of complications in the face? Saitan says middle. No. Good guess, but you had a 1 out of 3 chance, so we're down to we're down to 1 out of 2 chances now. Is it the upper face or the lower face? It's the upper face, Tracy. Exactly right. And what about the upper face? Upper face, right, Carmel? Oh my God, lower, Christina. Sorry, you buzzed in too late. What about the upper face is so complicated? What do people keep doing wrong? It's the forehead, right? So it's neurotoxin in the forehead, and probably one of the most commonly treated areas, also the area where we see the greatest number of not great results. And to me, that's pretty simple. It just breaks down to a lack of understanding of the anatomy. The fact that you've got 4 sets of muscles pulling down and only 1 set of muscles pulling up. And that 1 set that's pulling up, the frontalis, is relatively sensitive to neurotoxin, is easily treated with relatively small doses, is many times over-treated and you're getting brow ptosis. So, part of it is just a misunderstanding that when you have depressor muscles, the 4 that I'm talking about around the eyes, those 4 pairs of muscles are pretty strong because we do a lot of sort of groaning and making motions with our faces where we're using those muscles, and they're getting pretty strong. And so you need to treat those very aggressively so you get some elevation of your brow, because as we all know, with age, brows drop for various reasons. But part of it is loss of volume. Part of it is the muscles are strong, pulling down, and the frontalis is weak. And we're trying to treat those muscles. We have to take advantage of the fact that we really want to be aggressive with our depressors and relatively conservative with our one frontalis pair that lifts. And, as you know, I've said many times, you can always give more neurotoxin, right? If you underdose the forehead a little bit, particularly the frontalis, you can always give a little more. But patients without it would rather have a higher raised brow with a little bit of wrinkling than a silky smooth forehead with a lower brow. Trust me on this. Brow elevation is your most important consideration when you're treating the forehead in someone with a little bit of low brows. And that's pretty much anybody in their 40s and up, right, has a little bit of brow ptosis, particularly laterally. That's one of the things. The second thing is most people don't understand how treating the forehead can give you eyelid ptosis, and they haven't really understood the interaction with the levator, how close it is to that lateral corrugator injection, how close the septum is, and how if you go just a little bit lower or give a little bit too much of a dose, it can seep through the septum and give you eyelid ptosis. People just don't understand it. Also understanding that you have to keep the lower part of the frontalis functional. You never want to treat the lower part of the frontalis because that's the only part that's holding up your forehead. So you want to treat your foreheads high. You want to not be too far lateral because there's no muscle out there, number 1. But number 2, you want to maintain lateral frontalis function because the most obvious area where the brow drops is laterally. So if you kind of weaken the frontalis laterally, you're going to get that. So, just understanding the anatomy is really important. So that's the biggest problem I see is people misunderstand. Even veteran, whatever that means, injectors, seasoned injectors or experienced injectors get it wrong. And when you try to have them, hey, Lulu, how you doing? Good to talk with you. Thanks for joining tonight. Even experienced injectors, surprisingly to me, I was telling the class, when I was on doing a live last week that, I had a class recently where I was doing cadaver and I had people in the class who were very experienced doing injectables, in the face. And during our course, which included a didactic portion and a cadaver hands-on portion and an assessment portion, if I said to you, hey, there are 3 people in this class who've got more than 12 years experience and one's got nearly 20 years experience, can you pick them out? You'd say, oh, well, obviously those people know what they're doing. Obviously that person who's answering all the questions. It was a 0. It was like you couldn't tell them from someone who had never taken the course before. So it was shocking and disappointing to me, and just kind of played up the same thing I've been saying, that the level of aesthetic education, even for experienced people, is pretty low. So what does that mean for our patients? Hey, Maddie. What does that mean for our patients? What does that mean for our results? If even what we call seasoned injectors don't really understand the anatomy of the forehead. So that's the number 1 thing I see. Another thing I see is, and this is a mistake that people may make early on in their ascent up the ladder, doing sort of short, problem-focused consultations, right? Like people coming in for one thing and just acting like a technician and just treating that thing. I know it's exciting and fun when you're getting started, but you got to be better than that, right? Because if someone just comes in for one thing, it's like when you bring your car to the mechanic, do they ever just say there's one thing wrong? Do they ever just say, oh, all you need is this and you're done? Or do they check the entire car to try to find one or two or three things, maybe that aren't wrong, but that you're good in, they're in the yellow zone, that your brakes are getting low, or your windshield wipers or they're kind of old, or whatever. They always do a complete evaluation of your car because they want to tell you not only does your windshield wipers not work, but all these other things don't work too. And if you're here, we can fix them for you. So why are we any different than that, right? I mean, why does someone come in and want their lips done or whatever, and we just do that and don't look at anything else? I mean, that would be silly, right? But that gets done a lot too. So, hey, Kate, good to see you. Thanks for joining tonight. I saw you just posted an Instagram post of you teaching, and I was like, you're like one of my mini mentors, maybe, huh? This is kind of cool. And I noticed a similar style to someone I know. Well, so if someone comes in and you're just doing one thing, the thing that they want, aren't you like the mechanic? You just come in and they just fix what you want, and you drive away, and 30 minutes later your tailpipe falls off, and you're just like, shit, I was just at the mechanic. Why didn't they look at, it's kind of the same thing, right? I'm your fave. You're my fave. So it goes hand in hand. How's married life? You're the newlywed of a couple of months, right? So how's that going? You guys still together? I saw some beautiful videos, and hopefully you have a happily ever after life. I wish that for everybody. So when people come in, don't do the short, yeah, me too. I'm learning every day too. I still try to learn something every day, and I do. It's kind of amazing. And sometimes I learn from other people's mistakes because I'm always trying to figure out why they're making those mistakes. That's kind of why I'm talking about this tonight. But when someone comes in, try to do the full thing. Now, you say, well, that's kind of silly because most of my patients are young and they all only want lips. Well, you know what? During the cadaver course I just talked about, our very first model that we as a group were looking at to evaluate and assess her face, guess how old she was? She was 24, learning every day thanks to you. It's good. Haven't killed each other yet. Then if you haven't killed each other in 2 months, it's all going to be good. You don't have to worry about it anymore. Just what I learned today was, don't ever try to change your spouse. Like, just accept them for who he or she is, and live with it and love them and accept them. I mean, just let them do their thing. But it's hard to change people, right? It's really hard, and if we get caught up in that, it just creates problems. So, live and let live. So this nurse was 24 years old. She's beautiful, and everyone's like, she's 24. Like, what are you going to find in her? Well, guess what? We spent 30 minutes analyzing her face, and we found a lot of things. Now, listen, the bottom line is she's still beautiful, right? And you look at her and go, oh my God. But then when you start doing the micro and start examining all the little things, like which brow is higher, which eye is lower, which cheek is higher. She had one part of her jaw that was really long with the other. She had her chin canted out to one side. But you know what? You don't see it from this distance because all you see is the beauty of that face because everything worked for her, right? She was stunning. But when you do it this way, because my point was, so she comes in and she wants you to do something, right? And if you can't identify the problem, how can you fix it? Iced coffee. Yeah, that we'll have to tell the iced coffee story at the end. Remind me at the end. I'll tell it. My wife will get a kick out of it. So if you don't know which side of the face is fuller and you treat them equally, maybe you made the fuller side fuller, or if you've made the fuller side, the fuller side fuller because you thought it was less volumized, then you made it even worse. So we spent a lot of time, and like every class, I go, okay, half the class is over here, half the class is over here. Which side of the face has more volume? And half the group says right, half the group says left. And I go, okay, how can half the people in here see the right side and half the people in here see the left side? When you're looking at the same face, under the same lighting conditions, from the same distance, I'm turning the head all around so they can see. They just couldn't see it. Which brow is higher? They couldn't see it. So by the end of it, they saw. But my point being that even this 24-year-old had a lot of things that weren't perfect, that were asymmetric. So if you didn't realize which side of her jaw was longer or which brow was higher and you went to do something, you make it worse. So if you can't see the problem, how can you create the solution? So that's really an important part of being a good injector, is doing a thorough analysis of the patient's face. So those very short, focused consultations really are doing you a disservice. And just think, if you were a mechanic and did that to somebody, you'd lose your job, right? People would never come back saying, I was just in the shop and you looked at my car, you fixed the headlight, but you didn't look at anything else, and my tailpipe fell off. So aren't we better than that? We've got to be better than automotive technicians, and our education costs a lot more, so we should be better. Anyway, that's 2. Number 3, we're talking about some of the problems I see in the industry over and over and over again, and maybe some potential solutions. Number 3 is not saying no, right? Not saying no when we shouldn't do it. Not saying no to someone who's already too filled. Not saying no to someone who's asking you to do something that isn't right, that doesn't mesh with your aesthetic. Doing something because the patient wants you to, or maybe you need to make a tuition payment, or maybe your mortgage is whatever. Don't cave to that, please. I promise you'll be sorry. And it's happened to me. I've done it. I know when you're starting out, you're trying to help everybody, you're trying to do good things. You do have monetary pressures, but those aren't good reasons to do things that you shouldn't do, right? Because it will come back to haunt you. I guarantee it, in one way or another. So don't be afraid to say no, because people are coming to you and you're the expert. You're the person who's supposed to say, you know what? Let's just do an analysis. So just look at the proportions of your face, and we know the dimensions are supposed to be 1 to 1.8, 1 to 1 to 6.8. We know the width is supposed to be, equal fifths. The height's going to be equal thirds. We know the ratio of how much lip there is to the lower third of the face, and how much chin there is relative to lip, and all these things, right? So we should say, well, no, let's just look at it. You can take out your calipers and you can measure and stuff. But by looking at somebody, if you look at someone and you can't stop looking at their lips or eyes or brows or cheeks or whatever it is, it ain't right. Your eye doesn't stop unless it sees something wrong. Once it sees something wrong, it just stops and goes, what the heck is going on there? That to me is not natural. Like that 24-year-old I was talking about who had all those things. But your eye never stopped, because she was just so beautiful that you just saw the beauty and you didn't see any of the micro. When you really had to focus, you really had to stop your brain from telling you everything looked beautiful, saying, no, brain, I know every single person, every single face I look at has asymmetry. It's just up to me to be good enough to find it. It's up to me to see which brow is higher, which cheek is fuller, which jawline is longer, how what the projection width and depth of the chin are like. Until you go through that exercise, how can you help somebody? So don't be afraid to say no. The second thing is, don't be afraid to say no again, right? Because patients will pressure you. Patients will try to, give you some sort of reason why they have to have this, and they'll threaten to go to other people. And, that might not be a bad thing, to be honest with you. Some of these patients who are trying to force you to look at their aesthetic, rather than you saying, you know what, in my opinion, in my professional opinion, you shouldn't do that. We shouldn't do the lips. We shouldn't do any more than cheeks, because you can barely see your feet from where you are now when you look down. So, enough said about that. But just do the right thing. Do what you would do to that person if they were related to you, your husband, your wife, your sister, your friend, whatever. And treat everybody that way. Like, treat everybody like they're part of your family. Like, you want them to look their best, and you want them to be their best. Let the money signs go. Let the pressures go, because that's the quickest way to the bottom, honestly. Okay. Number 5, setting realistic expectations, right? So, some of us are very impressed with ourselves and think that we can do. Speraza was in my class. Hello, how are you? I'm waving to all these lovely friends of the show who joined and watched. Good to see you guys. So, your competence has to match your confidence. And when we get high confidence and low competence, big problem. When we get medium level competence and medium level competence, we're pretty good. There are people who have a high level of competence, but a relatively low level of confidence. So that could be a little problem. They just need a kick in the boot. Good to hear you're doing great. Happy to see it. I had no doubt you would. You were a star. So, it's the high confidence, low competence people that scare me and should scare everyone else. Because if you think you're better than you really are, that's a real setup for trouble. And if you think you don't have to read and study and go to classes and watch videos and listen to people, and then you're on the fast path to the bottom too. So setting realistic expectations, not only for the patient, but for yourself. So when patients come in and they ask for all these things, and you say, oh yeah, we can do this, we can make you look 25, we can do this, and you don't, the worst thing you can do in that situation is sort of lie and overpromise and underdeliver, because that creates a disappointed patient, and that creates a lot of negative reviews. It creates a lot of, like, I don't know if I want to go back to that person, and it just puts you in a bad spot. So it's really better to sort of under-promise and over-deliver. You've got a very active muscle in your forehead. Your brows are really getting pulled down. So it's going to take a lot of, neurotoxin to treat this, and it's going to take us a little while to get it right, because it's a hard one. It's really one of the more difficult ones I've seen, but we're definitely going to make it better, but I'm not exactly sure. Or those lines are really deep, they've been there for a long time, and I don't think that we completely get rid of them, but I know we can make them better, we can make them softer, use terms like that, be realistic, be honest with people, and if you set the expectation, if you set the bar at the right level and you jump over the bar, you exceed expectations, you, my friend, are a hero. You have done what is almost impossible to do. You've given someone more than they actually thought they were going to get. That creates excited patients. That creates loyalty. That creates good reviews. That creates a successful business. So, and if it's above your pay grade, if you're not up to that level, be honest with people. I haven't done many of those, and I'm just not really comfortable. I'm not confident I can get a great result for you because you're a little bit more of a difficult case. So, I don't want to inject your whatever it is. That's better than doing something and hurting somebody, or getting a bad result or getting no result, or you don't want to step down that road. So keep it simple, keep it safe. Stay within yourself, stay within your comfort zone, stay within your abilities, right? And sometimes when they come in and you're just like, what? That lower third of the face where you have all that, the jowling, the excess skin, the platysmal banding, the loss of the cervical mental angle. To be honest with you, neurotoxin and fillers, even energy-based treatments, aren't going to be enough to really make it worth your while, in my opinion. You need to see a plastic surgeon or someone who does that, because that's the honest thing to do. I see patients sometimes when I say to them, what? I don't think that surgery is going to be worth it for you. You have so much laxity. You're a little bit older, whatever. I can do it, and I know that you'll get some improvement. But in my opinion, the amount of money you'd spend for the amount of result you're going to get, it's just not worth it. I wouldn't recommend it. Like if you really want to get some. So I'm very honest about it. I don't want to do the surgery on somebody and have them come back and say, I got like 10% improvement, and so we had that discussion. I don't even want to have that discussion. I feel like it's just better saying, I don't think it's worth it. Maybe you're past the point where it's going to help. So be honest with yourself, be honest with your patients, and know when to refer. The next area of problems is treating difficult areas as a beginner, right? So we have modified our teaching at the school at Aesthetic Mentor. And if you're not already with us, go see the link in our bio and check out our schools and what we do in our curriculum. We're just kind of building this online library. It's going to be a powerhouse. We will be the gold standard for aesthetic education, I'm sure. But what you'll understand is that so when we used to have our intro to neurotoxin or intro to dermal filler course, we had like all the areas that you could treat, and it was just this comprehensive list of things. And as time has gone on, the experience has gotten smaller and smaller and smaller and smaller, because it's not about when you first learning how to inject 12 or 15 different areas. It's about how to inject one area really well, or two, or even three. That's it. Because it's not about that. It's really about the technique. How do you do it? How do you do it safely? What's the anatomy? So you really hyper-focus, obviously, on, in the intro to neurotoxin class, the forehead, the glabella, and the crow's feet. And we even had some people say, we should just do one area because it's really not about the treatment. It's about the technique and the safety and, the efficacy and all of that. So, our courses have gotten sort of condensed and hyper-focused because we realize that it doesn't matter how many areas you do if you don't have the good technique, if you don't understand the anatomy, if you don't understand the particular areas within that region of the face that are important, where the vessels are, where the nerves are, where the muscles are, then we haven't done our job. So I call it the school of hard knocks. So Steph, it's all about the school of hard knocks, right? Because it's all about getting out there and doing something you haven't done before, and most people don't have the adequate level of training to do it. So we learn by making mistakes. But Mr. Hard Knocks or Mrs. Hard Knocks, it's Kate, yeah. The part about the hard knocks is like if you get a hard knock and you're like, I really messed that up, and then you do the same thing again, you should get hit in the head with a rock because you're not learning anything. Like mistakes are certainly stepping stones to learning if you examine why you made that mistake. And if you're not sure, ask someone else who's done more of those. Your didactic course was fabulous, how you broke all the anatomy down. Yeah, because, thank you for pointing that out. I broke it down because if you don't understand the anatomy at that level, then you're just guessing. You're looking at somebody and go, the person I saw just injects here, 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 and here. Why? I don't know. I saw it on a video. Well, do you always do it the same way? Oh yeah, do it the same. So to me that means you don't understand anything, right? So it means that you're just like a puppet or a technician. You're not taking the time to learn the anatomy, to learn the dosing, to learn where things are and where they aren't. So that's what we decided to get it because all of our courses have been an evolution. We looked at our results and say, why are people still making these mistakes? Well, we're not teaching it right. Why are people having this problem with lips? Oh, because we're not teaching it right. No, we're not teaching it right. We can teach it better. We can teach it better so that we minimize the number of mistakes and problems and bad outcomes we have, because that's what this is about, right? That's why we're all spending part of our Tuesday night. My God, it's already 7:30. I've only gotten halfway through my list, so I don't know what I'm in a panic. Should I just do the rest of it next week, Mary Kate, or should I keep going? I'll keep going until people start turning off, and then I'll do. Another thing, beginning injectors, watching them, rushing. You should be the slowest injector on earth. I mean, I've been doing this since the beginning, and I take my time when I inject. I really, really do, because patients understand if you're taking your time with them. If someone comes in for Botox, or any neurotoxin, I'm sorry I used the word Botox, but if someone comes in for neurotoxin, I happen to use a lot of Botox, so that's why it slips off my lips. But if someone comes in for a neurotoxin treatment, the average neurotoxin treatment, the actual injection time is between 30 and 90 seconds, right? How long do I think a Botox or filler appointment should be? Okay, I'll tell you. They booked me for a Botox or filler appointment, for 30 minutes. And as I just said, it takes 30 to 90 seconds to do it. So what the hell am I doing the rest of the time? And why spend that much time with that patient if I could do 5 or some number of patients in the same amount of time and create more revenue? Why? Because that's not how I practice. Okay? So if I'm seeing a neurotoxin patient, I don't even talk about neurotoxin for the first 5 minutes. I talk about them. I talk about what they're doing. If it's a first-time patient, I do a full medical history. I talk about their job, their husband, their kids. I want to get a feeling of who they are, where they're from, what they're doing, what they're up to, what their level of expectation is, have they had prior experiences in the field, have they been good, have they been bad. I found that all this, I'll do the 5-minute injection in a second, but let's find out. And some people will give a cosmetic interest questionnaire in the waiting room so they can see all the other things that they might be interested in. So, I see you checked off you're unhappy with the area of your waist where you think you have excess fat, or you're unhappy with the position of your brows, or you're unhappy with your belly, or whatever it is. But it's a conversation. And then when we get to the part of injecting, I explain in detail what I'm going to do. I explain all this stuff. Even if it's a patient I've injected 20 times before, I still will go in and talk about, hey, so how was your Memorial Day? Did you do anything special? Have anything planned for the summer? Because, that's important, because it gives the patient time to say, what? I meant to ask you, I've always hated my breasts, and so can we do something about, it opens them up to a relationship with you, and it opens them up to thinking and hearing about other things that you do. So Kate's asking how long my filler and neurotoxin appointments are, and they're minimum of a half hour. And I think for filler they might even give me 45. I don't know, but I usually use the time, and I'm not like, I don't look at my watch. I never look at the time, but I'm hardly ever late because I have a sense of like what's next. But I use that all that time, and I stay with the patients, and I make them know that I'm there for them, and I'm there to listen to what they might be bothering them, and I give them that full evaluation. And sometimes I will even say, you've been doing neurotoxin here. Have you ever thought about that? Or you look like you might be losing a little bit. Have you lost a lot of weight? You might need a little volume in your cheeks, whatever. So that's important. Just take your time with these patients. It's not about how many patients can you do in an hour. It's about what's the quality of your work. Do you have an established relationship with that patient? Because I'm seeing patients back that I've been treating for 20 years sometimes. I saw a patient today that I hadn't seen since 2006 or 2008, and she came back, right? Because she had a good experience with me. We had she had a good result, and she knew that I cared, right? And when she came back in, we kind of picked up where we left off, 8 or 10 years ago, whatever it was. And that happens to me all the time. And that can happen to you too, but you have to put in the time up front and create that relationship, create that trust with the patient, and you can carry that forward for a long time. Another big problem, lack of knowledge of the anatomy. And when people do take my anatomy course, I say to them, this should not be the last anatomy course you ever take. You should take one at least once every year or so, because the better you become as an injector, the more anatomy you will want to know, you will need to know, the more you'll understand, oh, that's why that happened, or that's why that the eyebrow went that way, or that's why I got all that bruise. The more you do in this field, the more anatomy you need to know, and the more anatomy you know, the more anatomy you need to know, and the better. It's a big circle, but the best injectors are the ones that know the most anatomy and care about what they do. So that's a big problem. I just got a couple more left. One of the other things that's really hard when you start out is to be solo, like to be out there on an island by yourself. It really slows down your learning. If you can be with other injectors, be in a Facebook group or some kind of mentoring group. If you can join a practice where there are other injectors who are much more experienced than you are. You can't. I'm doing an IV live. I'll be back. It's my dog. He wants to hang out with me. I close the door on him and he's really mad. I'll be right out, Matt. Just chill out. Being with a group of people that are better than you is what makes you better. Just order the facial anatomy coloring book. Yeah, see, those kinds of things are really helpful, because then when you're looking at an area, you're not just looking at the wrinkles, you're thinking about what's under the wrinkles. What is that anatomy? How does that muscle shape? What's around that muscle? How deep can I go? What's the muscle behind it? What if I go too deep? What if I go too superficial? There's a tremendous overlap of muscles, and if you don't know any of that, you are, without a doubt, going to have a significant number of complications. There's no reason to be injecting in the face and not knowing the anatomy. There's so many places to learn it. I have that. It works well and helps me remember anatomy better. See? It works. So just try. Try your best. Learn the anatomy. Come to my course. I'll teach it to you like you've never seen it before, and it'll be easy. Better late than never. Another problem I've seen is lack of significant follow-up. This is the last one, so you can ask me questions now if you want. So you go someplace and you get treated, right? And how nice is it? And people always comment about this when they write reviews and stuff for us, or when they see me personally, say, I really appreciated that call last night to check on me. Even though I said everything was fine, you still checked on me, and then when I didn't answer the phone, you left a message, you called me the next day. I felt so well taken care of. I felt like I could call you if I needed to, because you were checking on me, and it showed me that you were concerned. And you know what? When you're starting out practice, or at any point in your practice, we still do it. My practice for all of our surgical patients every time. Call them. Just say, hey, just want to check, make sure things are okay. Particularly with your filler patients. That's going to be the time where you're going to be so glad you called, because someone's going to say, I'm having pain in my face, but I have pain in my face, but my wife's asking me to go to dinner, so I've got to eat quickly. I'm going to talk quickly. So when you call them and they say, one side of my face is just hurting more than the other, I guess maybe it's just bruising. Let me see. Send me a photo, or actually do a video and send it to me right now. And that's sometimes how you pick up problems that are starting, infections, occlusions, bruising, all kinds of things. And sometimes you need to see the patient. So, and when you do that, you're a hero forever, right? If you save someone, if you get someone in soon and, save them from all that heartache and misery from an occlusion or something like that, it really goes a long way. And 99% of the time where everything's fine, well, maybe not that high, maybe 90% of the time where everything's is fine, they appreciate it. They appreciate the call. They appreciate it. They always say, you know what, I'm glad you called. I had this question. I didn't want to call and bother you to ask you about it, but now that you've called, it really goes a long way. So it's all about building trust, and if you're in this industry, you should care about people, and showing it to them actually just makes it even better for you. And when you hang up the phone and someone's like, I'm really glad you called, you just feel like a little warm feeling inside, like you've done the right thing, and it just makes you want to keep doing it. And I used to do it personally for every single patient that I worked on, because it was important to me, and they always appreciated it. Thank you. Always make me feel better when I watch. Makes me realize I'm not alone on my journey. No, listen, you're not alone on your journey. There are, and I'm not even joking, there are millions of other people who are starting this journey. It's a really hard journey, and most people fail. Just being honest about it, folks. And it's hard because there's so many people trying. There's so few educational opportunities out there that are of any real value. There's so many patients coming in. There's such pressure for everybody to perform. There's all these new technologies. There's new fillers. There's new neurotoxins. There's new devices. So you need someone to help sort it out for you. So that's why I'm here, to help give back to you guys, because there wasn't any of this stuff. I was a solo guy. I did this all on my own. I didn't have any real mentors to ask. The world of neurotoxins and fillers was brand new, so no one really had any experience. So we were all doing it together. We all made the same mistakes, and so we're here to stop that from happening. We don't want you to make these mistakes. You don't need to make them and hurt your patients, hurt the industry, hurt yourself. So rely on us. We're here for that. So I am the aesthetic mentor. I'm Dr. Russo, and it was a pleasure talking to you all tonight. They usually repost these if you want to watch them on Fridays. Sometimes it's a screwed up week where I thought today was Monday and wasn't going to be here in time for my live. I said I couldn't do that to the people who want to watch, so I I drove home quickly, quicker than I usually do, to try to be here in time, and I just made it. So thanks to all of you. Have a great week. And I lost a patient this week. She said she is able to get Botox treatments for $8 a unit. You know what I say? Good riddance. You don't want those kind of people in your practice, because the minute someone sells it for $7 and it either waters it down or buys it from a foreign country, gets thrown in prison, or dilutes the product, they'll go to the person who sells it for $7. And you don't want the bottom feeders. Like, if someone says that to me, I was like, that's great. You should go try it and see what you think. And people always come back, you know what, doctors, I made a huge mistake. Will you take me back? I say, yeah, it's all good. Yeah, you come back, But it teaches them that, you get what you pay for, right? The why. Why is a person paying $6 for neurotoxin and selling it for $8? Because they're desperate. It's a race to the bottom, and they're going to be out of business pretty much before anybody else. So that's another trap that you shouldn't fall into. Here he is. Come on, everybody. Here's my boy. Come on up so people can see you. Come on up. Here he is. The most beautiful gold. Look at that. Look over here. Oh, he's right here. There's Mac. Anyway, I've got to go. If that person ever calls you back, say, yeah, you can come back, but our price just went up to $15. You're welcome to come back, and I'll fix the mistakes you made that were made on you. And I always say to patients, if your only decision's about price, you're coming to the wrong guy, because I'm not the lowest guy. I never was. I never will be. And if you want to go to if you want to be a shopper at the lowest end store, your clothes are going to last for a week and a half. If you want to go someplace, you get what you pay for. That's what the world's about. Anyway, I got to go. I'll see you guys soon. See you next week. Bye. Have a good night.